Cool. Well, hey, welcome everyone. Thanks for coming. My name's Jason London. I am a PT here at Excel and one of the owners, and we are back to doing community education seminars. We did have to take a little bit of a pause during COVID, but we're really excited to be back. We've already done 3 others so far this year. And this will be our last one before summer, and then we'll probably have some more going this fall. So these are free events, but we are really trying to raise community awareness and help support our local trails. So if you'd consider making a donation to either GVLT or Dirt Concern, there are QR codes here and QR codes around, or Nicole is taking donations to, if you want, on your way out. We'd really appreciate it. And GVLT and Dirt Concern / Swimbo would really appreciate it as well. But I'm really excited for get this working. Our topic tonight, so it's going to be all about really endurance sports and trying to mitigate injury risk. We can't totally prevent injuries from happening, but we can try to do some things to decrease the risk of injury, as well as some ideas for increasing performance too. And we have a stellar lineup this evening with AJ Sobrilski, Tiffany Sherman, and the one and only Nikki Kimball as well. So I'm going to turn it over to AJ, and then we'll kind of be bouncing back and forth here.
Working. Sweet. All right. Well, I know everybody's here to see Nikki, so I'll hurry up and get through my slides. But yeah, a lot of familiar faces, so thanks for coming. And a lot of them not for a while, so it sounds, hopefully people are doing well or they're just going somewhere else. But how many of us have ever been injured from running or biking? Yeah, so I mean, the statistics are pretty high, 82 and 84% hurt in their career. I'd argue that it's 100%, and the other 18 and 16 just don't tell anybody about it, and they pick a different sport. And roughly half of those every single year. How many of you would say you get some kind of injury from running or biking or maybe skiing each year? Something that hurts. Me too. We're not, immune to it. So yeah, we all have something in common. That's great. So what do we think causes running injuries? Anybody throw it out there? Yes, like training error, right? That is definitely, when we look at some of the established risk factors, high BMI, a prior injury, and then training error. So too much, too soon, too fast, lots of little things can fall in there. What about for biking? Okay, well, sorry? That is something that Jason and I would probably agree on, a lot of people, that in combination with maybe something that's already hurting or a prior injury, or again, training error. So less established risk study, but some potential risk factors, okay? So a lot of what we're gonna try to talk about tonight is how can we try to mitigate these, like Jason said. So just real quick, cycling and running, we see 2 kind of types of injuries. There's the traumatic ones, so you're riding down Leverage and that bump that wasn't there last week is now there because everybody hit their brakes and it slides out. And you have the traumatic one, or again, a lot of them are, we got too psyched, it's nice on the weekend, copper's dry, and we're riding hard. I get it. Running, same thing, fall, trip, end of the ridge run, your quads are blasted, there's that one little rock right at the last steep part of the M, something twist, fall, hit it. And then there's those ones where maybe you're following your own plan and not paying Nikki to coach you and do it the right way, and something gets injured. So those traumatic and then those kind of overuse load management errors. And so how can we be as injury-free as possible? Because again, as best as we can try, we probably can't prevent them. And it's really this balance between these training load factors, again, so volume, intensity, frequency type, and then there's some other ones, stress, work, sleep, other habits that will affect that training load in combination with what our body has to offer, these tissue load capacities. And so really we start to try to find that balance between training load and our body's ability to tolerate those loads, okay? And when we have excessive training load and it overloads our tissue's capacity, we get what we like to call a reactive response or pain and injury. Something's not feeling good, okay? So really it's this balance again. We're trying to find the sweet spot between training enough so that we can have high performance and training not too much so that we don't get injured. And unfortunately, usually when we have high training loads, we have a better performance. But then again, when we have a lot of training load, we tend to have a higher relationship to injury. So it's maximizing those positive training adaptations while trying to minimize the training load kind of related effects. And it is a juggling act, and it doesn't matter how good you are at it, there's always going to be this ebb, flow, swing, challenge, change, okay? It's difficult. So what does this look like? So this is a little graph I drew out. Down here we have January, the months kind of leading to August, and we're kind of thinking, maybe Big Sky Biggie, or even the rut down here in that late August, early September, right? Here we have, let's just call load, okay? Whether it's running, biking, doesn't quite matter. January we're skiing, February we're skiing. Here everybody goes on a little spring break trip. They go down to Utah and bike, run, climb, something like that. So we get a quick spike. We're back for a few late storms here. And then things start to dry out. The trails, copper, we ramp up our biking. We get another little spring storm here, so the trails are wet again. And then all of a sudden we're seeing those really good days and we're getting psyched. We're riding every night, every weekend. We're ramping everything up. And here's that steep rise and that reactive response. And now all of a sudden we're spending parts of June and July having to modify all the activities so that we can get better feeling for that. So what can we do differently to maybe make that less of an issue? So again, here, maybe we're spending a little more time on the trainer, the treadmill, or at the mountain project, working out, working on those other things, not letting it be so stagnant. Sure, we still have that spring break trip, but we come back and go, you know what, I'm getting psyched. I'm going to put a little more time into it. Again, and here we see this kind of nice ebb. This isn't perfect, but a little bit smoother of a trend with some dips and dives all the way working up so that we can have that higher training load and thus likely better performance at what we'd like to do, okay? So what does this mean? Really, it's just an excessive load on the tissues leads to injury. So two things here. We can either reduce the load, which isn't always our favorite thing, and we can increase tissue's capacity. And by either reducing load and increasing the capacity, we can kind of mitigate some risk for injury. And I think really the biggest things we can work on to do that is changing gradually, whether it's vert, mileage, speed, ramping it up slowly. Usually the steeper the curve, the higher the risk. And usually the steeper the fall is off the other side that you have to stop. And we can manage some of those modifiable factors, which we'll talk about coming up here. And then really just work to increase capacity. It's sleep, nutrition, strength training, mobility, all those little things you can control. And really, again, modifiable factors, some of these here, and then tissue capacity things here. So we really need an individualized rehab and performance program and training. Again, this one size fits all, it doesn't usually work. Again, Andy's going to be able to go out and ski laps 500 times more than I can on the winter because he's got such a training capacity and a background in it. And so vice versa, everybody's a little different on how that steepness and what those pillars all entail and account for. So again, brief review. We need to, kind of make sure our loading habits don't exceed our load capacity. So bring these down while we bring these up, and then slowly ramp those loading habits back up so that they can tolerate those changes. But what happens when we do have that injury? Is rest really our best option? Should we just stop skiing, stop running, stop biking until things feel better? And it might be a little bit of rest, but it's probably not as much rest as most people initially take. So the next little kind of scheme and diagram here is kind of this pattern that we see play out here in the PT world a lot. So basically, we're ramping, running up, boom. Here is the last weekend in April. It's sunny, it's dry. Moving in through June, we go to copper. Again, we haven't had the capacity built up yet. We get this injury or there's complaint, okay? So now what do we do? Now that something hurts, do we just stop biking until it feels better? Well, that's what a lot of people tend to do. So they just near sharp drop off of the activity. And when they drop that activity, we see a loss of the capacity of the muscles and the things that like to do it, whether it's biking or running. Okay, and so all of a sudden what happens is you kind of get down here and it feels better. But at that time we've taken off, we've lost some capacity with it. But feeling better doesn't mean it's healed or able to do the things it wants to do. And what we end up seeing then is we ramp that activity back up right away because it feels better. It must be healed. But at the same time, our capacity lags behind. And what happens then is we start to see what we like to call the chronic rehabber, okay? I took time off, it feels better, but then capacity falls. And we're never really giving our body's tissues and our capacity that time to kind of catch up because those take a lot longer than saying ramping up mileage, ramping up vert, And then there's this delayed response and these kind of reactive issues we get, okay? So the goal really becomes to rest better. So we get this injury, again, we have to take a little bit of time off, but we need to maintain the capacity as best we can through what we would like to call relative rest. And I call it kind of don't let the ship sink, even though it's got a little hole in it, okay? And so that might mean, gathering your team, your PT, your massage therapist. If you're a runner, you probably need to go buy a new pair of shoes and talk to a psychiatrist. I get it. I've been to that person too, all right? We really need some sports and performance-specific training. So just because your knee hurts on the bike doesn't mean you can't be working your hamstrings, you can't be working your mobility, you can't be working power as long as your knees are hurting. So those sport-specific things. Sometimes gait analysis or a bike fit will help change the way those tissues are loaded and then thus changing the load on it and modifying the capacity. So again, we can change the loading habits, bring the capacity up at the same time so that when you can return, you can now get beyond your previous capacity level. Again, control those modifiables, the sleep, the diet, the stress, all the other little things. Cross train. And when in doubt, just buy a new bike. That solves everything. No, I'm just kidding. So really, the question is, we're going to move forward and talk about how we can work on these specifically. And rehab is training. So don't forget that. Should be good.
All right, so now we're going to talk about some mobility and technique that's pretty common with a lot of runners and some with biking. So how much mobility is important, right? We want just enough of range of motion so that we aren't, so just more range of motion does not reduce your risk of injury or improve your performance, but lack of mobility can lead to compensatory movements and change in load in the tissue. So you don't necessarily have to be in a pretzel like this guy, but you want to make sure that you have enough range of motion that your body's not trying to compensate and get you through your training and your running and your cycling. So 3 big things is we want to make sure that we have enough ankle, toe, and hip range of motion. So some of the stretches that we can work on are you're just going to put your foot up. You're going to want to not let your back arch. You're going to tuck your tailbone underneath you, and then you just lean forward a little bit until you feel a stretch right here. So that's going to work on a lot of hip extension because when you're running, your hip should be behind you during certain parts of the gait, because if you don't have that hip mobility, your back is going to compensate and can lead to other problems or other injuries. Another big thing is having good toe extension as well. So you want to make sure that your toe can bend backwards. Sometimes people can get either like foot pain. You can have some tightness down that arch of your foot. You want to make sure that you have a good range of motion there. So just bending back that toe, letting you feel that stretch. And then for these other ones, 2 main calf muscles, you got your gastroc and your soleus. So when your knee is straight, you're going to feel it more in like the meaty part of your calf. Okay, so that's going to be your gastroc. But then you also want to make sure that you're stretching it with your knee bent too, so that you're feeling it a little bit more towards your Achilles as well. Biggest thing with stretches you want to make, it doesn't mean that you have to hold it for like 5 minutes for you to make that gain. The overall goal is to do for a minute total. So whether that means you're able to tolerate a low intensity stretch for about a minute, you can do that, or you can do like 3 times 30 or 3 times 20 seconds or 2 times 30 seconds, whatever that means, as long as you're getting to that minute total to actually change that tissue length. So couple different forms that we can talk about with running. These are just some like common ones that we can see. One of the biggest things is we just want to make sure, a lot of people care about like, oh, am I heel striking? Am I striking on my forefoot, rear foot, different positions? But honestly, the biggest thing is that making sure that your foot is landing more relative to your body so that you're not landing way out here. It doesn't really matter how, like where you're landing on your foot, because there's different research that says where you strike may lead to like different injuries, but one is not necessarily better than the other one. So we just want to make sure that your body is a little bit, or your foot is a little bit closer to your body. And then this is for cycling positions. So at the bottom of your cycle, you want to make sure that you have a little bit of a knee bend. So this is just kind of a generalized position so we want about like 25 to 40 degrees of knee flexion. Everybody's a little bit different. You want about a 90-degree angle between your shoulder and then your body. You don't necessarily want your back super arched or super hunched over, just nice and neutral. Everybody's neutral is a little bit different as well. And then here, what we're looking at is just the position of like where your knee is relative to your hip and your foot. So we don't want that foot or that knee coming inwards or coming outwards or kind of like alternating between the two. We want it pretty in a straight line for that as well. Okay, so one of the common things that I feel like I see a lot is overstriding. Okay, some of the common injuries with that is some like knee pain, just like around that patella, and then also shin splints. So I wanted to talk about one of the things that you can work on your own if you're having any of those symptoms, or if you feel like maybe you're overstriding. Some people overstride on one side and not the other one. So one thing that you can do is change your cadence. The best way to do this is on a treadmill so that your speed can stay constant and so that that's not changing. And I know as the weather gets nicer, we want to get outside and run, but this isn't something that you have to do all the time, but just like try and train and see if that makes a difference on any of your symptoms. So you want your treadmill at a little bit of an incline, so about like 0.5 to 1.5%. You want to keep your speed constant. And then whether you have a friend or whether you have like a timer, and then you just want to count how many times you, in 30 seconds, how many times you land on one foot. So say your right foot. Then you take that number and you times it by 4. That's just called your cadence, okay? It's also, if you forget, you can also Google it, okay? And then whatever that number is, say it's 160, you want to do about up to 10% over that number. That's going to help you shorten your stride, okay? So you're not going to be reaching out quite as much. And then, so that's how you just change your cadence to get it so that you can continue with your training, but maybe not having as much pain. And then if you've ever done this before, it's mentally, I think, is very, very challenging. So I think it's like impossible to do it the entire time you're running. So you want to do it for 2 minutes on and then 3 minutes off. 2 minutes on, 3 minutes off. Okay. And then we've got Nikki going to talk about youth.
And kiddos. And we're going through this very quickly, but we are going to, because we want to have time for people to ask questions. So just know that if you don't catch something, just ask. And I want to stay on this slide for a bit. So kids are not small adults. I mean, we've heard now, fortunately, for years, women aren't just small men. Well, kids aren't small adults. And so there are differences in kids' physiology and mechanics that make them prone to different types of injuries. And the reason I want to stay on this slide, the cute little chubby legs, is that one of the things, especially with younger children, is their legs are short compared to their trunk versus an adult. So, we use our legs to really absorb shock. So they may be getting a little bit more shock. And so, and bike fit is probably going to change for kids. Middle school through high school, they're growing. So bike fit is going to be difficult. You may have to come in, more often to be fitted to your bike. Kids don't tolerate heat well. And we've seen in media, like big public cases of these kids are playing football, this kid gets hyperthermia and drops. It's just something to be aware of, not scared of. The kids will adapt to heat just like adults will, but don't push them hard in the heat. And so kids are also much more likely to get injured while they're in a growth spurt. And I was actually just chatting with AJ about this because it's a big deal in climbing too, because we have so many little joints here that if a kid is growing, they have just all these places to injure. And same thing with running more than cycling probably, except for bike fit. So what happens is, our bones grow pretty quickly, but the muscle and tendon complex does not grow at the same rate. Muscle hypertrophy and but not quite as fast. So on the long bones, and the cartilage of kids is less resistant to load, and so that makes as we're growing, growth plate injuries really common. I mean, we see this really commonly, like fractures in the growth plate. And it might be something from, just overextending the hip or kicking a ball or something like that. And one of my friends today told me about an injury that I didn't know about, called a patellar sleeve fracture. And this is something that, just to sort of illustrate this mismatch of muscle, bone, tendon, and cartilage growth, is the cartilage that's kind of over the ossified bone, the really strong bone on the patella, can fracture off of that with just a really, really strong, it's very rare, but a strong contraction of the quadriceps, kind of pulling that cartilage off the bone. And again, something people can heal from, but this is unique to children. And some of those cartilaginous and growth plate fractures are unique to children. So something you want to know about. Unfortunately, it's hard to predict growth spurts, but by measuring frequently, you can get an idea of, is this, you're going to be into the growth spurt, but you start measuring every couple of weeks or month, you start seeing growth increasing more rapidly than normal. That's a time to increase caloric load and increase caloric intake and decrease load. So risk factors in young athletes, some of this is really similar to adults. Previous injury, female sex, high training volume, early sports specialization. So one of the things we don't want to see is somebody spending, and I was guilty of this, when I was this tall, I wanted to be US ski team. I wanted to be Nordic skier. That's what I thought my professional sport would be. And all I wanted to do was that. And when my parents would be like, no, you need to play lacrosse, you need to play soccer. So that it turned out that was, good that they forced me to do those things, because running and cycling aren't going to help you grow bones that are really robust. We need that multi-directional loading. We need the cutting that's really aggressive. All of that stuff is important. And if we specialize early, we're just not going to get that. Leg length difference of more than 1.5 inches. Low BMI, high BMI is also, so either big or small, can be risk factors. Menstrual dysfunction, we see that all the time in cyclists and runners in high school. And Lauren Fleshman's book, Good for a Girl, is amazing. And anyone who has children, female children particularly, who are going to be running in middle school and high school should read that book. It goes into this in a much deeper way. And then, as Tiffany said, the step rate, that low cadence. So a cadence under 164 is a risk factor for kids and adults. So thoughts on mitigation. So, I already talked about early sports specialization, but also, one of the things you can do is just limit that kid to, the sport that they're a cyclist. Okay, well, you get 8 months, and that's easy to do here because, You know, unless you're just gonna be on your trainer, and what kid's gonna wanna be on their trainer when Bridger's got fresh snow? But we also do wanna add, you know, the racket sports, the ball sports, and it's also just teaching different skills. So it's important physiologically, it's important bone health, and it's important just to be a better overall athlete. I know a lot of runners who are great runners, but aren't great athletes. You know, they can run in a straight line fast, they look beautiful, they're awesome. But you ask them to like lift something and they can't. So there's you know, that's my stump speech on not being specialized. Also, rest periods. This is important for adults, really important for kids. Build them into the training. Make sure that they get a day off a week. And current recommendations are 1 to 2 weeks off every 3 months of their primary sport. And so again, we really need a lot more research, but best practice right now, prepubescent athletes, just no more hours per week of training than their age in years. And then, you know, do we want to keep that through adolescence? Well, 16-hour training cap is kind of where we are for adolescents right now. Of course, the vitamin D, calcium intake, and calories increasing during growth spurts. And then mostly keep it fun. I mean, kids need to be having fun. They need to love these sports, and they will if we keep it fun. And that's Jason.
Thanks, Nikki. All right, so I know we went through a lot of information pretty quickly, but just a brief recap. So AJ covered, you know, probably one of the most important things with looking at training in really any sport, but really with endurance sports, and probably one of the easiest modifiable factors, things that you can change pretty easily and influence very quickly, is looking at your training load and how you're progressing your training, as well as what are you doing outside of your training in that sport to help build more capacity with, you know, are you putting in some accessory work with some lifting or working on mobility work like Tiffany had mentioned, so that you do have the mobility in your legs to have proper running form. Again, one of the biggest things that we see as PTs with injured runners is with running form is people who are overstriding, meaning that their foot is getting out too far in front of them. And that puts a big eccentric load and a lot of jarring at the joints to lead to injury. Also, it really decreases performance too, because you're basically stopping yourself more with every strike rather than propelling yourself forward. So Tiffany also talked about some running form things where, again, it doesn't matter in terms of the overall injury pattern of where you're striking, whether it be a heel strike, midfoot, or a forefoot strike. It matters where that strike is in relationship to your center of mass. And then with your position on a bike, making sure that you're in a good position with that, where you are getting just a little bit of knee flexion at the bottom of the pedal stroke, you're in a good neutral spinal position, and that you're not reaching too far with that. And then Nikki ended with some considerations for youth athletes, really getting back to that training load and not training more hours than your age. And really important for particularly those middle school and younger athletes is not early sport specialization, making sure that they're sport sampling and trying out lots of different sports, especially sports with multi-directional movements to them to help build good bone growth. And in addition to that, really making sure that youth athletes and really any athletes are aware of, as your training load increases, your caloric intake should increase too. And signs that those are mismatched, especially for women and youth sport athlete females, is disorder or disorders with the menstrual cycle, where it's loss of a menstrual cycle. And that's a big warning factor. So for those of you with kids or know of youth athletes, making sure that you have that conversation with your kids on that. So hopefully, this was helpful for you and it keeps you out of here. But we are here to help if, unfortunately, you do sustain an injury. Most endurance sport injuries are overuse injuries, so they occur gradually over time and start out as something a little bit nagging, and then if you ignore it long enough, all of a sudden you can't do the sport that you love. So we can help with that. So we can assess, what your injury is, and point you in the right direction. If maybe you're not quite ready for PT and you need to go see a physician first to get some imaging, et cetera, or can we just develop a good program for you, like AJ said, and not have you be a chronic rehabber and have you have this just be this one session for you to get through that injury and then get back to your training and hopefully not become injured again. A big part of that is looking at your form in the sport that you're doing, whether it be with running, looking at running gait analysis and looking at your running form, seeing if we need to change anything and give you any drills so we can decrease load on that painful tissue. Or we do custom bike fitting as well, which actually involves quite a bit, but you bring your own bike into the clinic here, and then myself or AJ or another one of our PTs here will perform a bike fit. So we'll assess your position on the bike, your own bike, and then be making changes, as many as we can, with the equipment that you already have on your bike, and maybe making recommendations for different stem lengths and things of that nature. And if worse comes to worse, we do are experts in both operative and non-operative treatment and rehab. So I'd love to open it up to any questions at this point. Yeah, no.
Does that like multi-directional sport thing apply into adulthood of like to maintain bone?
So yeah, that's a great question. So the question is, with Nikki had talked about the importance of multi-directional sports for bone health. It's most important as we're really forming our bone density in our adolescence, but it certainly can help maintain bone health. But it's not as big of a deal once you're through puberty and done growing as for prior to that. What is important though is particularly with your endurance sports where there's very low impact, such as if you're really just focusing on cycling, swimming, and maybe even some with Nordic skiing, is that you are getting some impact throughout your training by either adding plyometric drills to your training or adding some running into your training too. And particularly as we reach the other end of the spectrum as we age, because that's where our bone health really tends to decrease. Great question.
I'd argue that it might not help your bone health, but it help mitigate some injuries in general. Yeah, I think we get all super tracked in our regular activities and forget the last time we sprinted or tried to side shuffle, and all of a sudden we do that one time. It's like night. So I think that variety and that playfulness, is something to try to incorporate as we get older. And I've been in that rut and had an experience, but if you all see people in here, runners, who we try to get them to go sideways or do something in rotation, and they just about, fall. So yeah, having a lot of that multi-directional movement is maybe not helpful for bones, but I think helps down the road with a lot of other.
But then don't take that and just go enter the most competitive men's league you can and end up with a ruptured Achilles or ACL. So pick up games in the park to start with. Yeah. Any other questions? Yeah.
About getting a new mountain bike, what can I look for to get the right fit and geometry and whatnot?
Great question. So with getting a new bike, we're really lucky, one, that we have great local bike shops here and that they're staffed with people who go through a lot of training with that. So as far as getting the right frame for your size, I really lean on the local bike shops with that. And the companies too have really dialed that into, even if you're ordering off a direct to consumer brand like Canyon, they have all these metrics with that. But knowing that, that's just really for the bike frame size, they're gonna put, just a standard length stem for that frame size and standard like setback on the saddle, but those are all things that can be changed if you get on that bike and it doesn't feel comfortable or you're noticing pain. Because really, when you're on your bike, it should feel like, when you're a kid again, where you're really not feeling any aches and pains other than just the muscular pain of, going through the activity and pushing yourself. Mhm. Yeah.
Risk to be aware of on before training, like also trainers, like under the ramp up, like that are certain should be, like the common injuries for the indoor training.
Yeah, so the question is, are there injury risks with, let's say you're doing running, like the majority of your running on a treadmill indoors, or you're doing the majority of your biking on a stationary like Peloton type bike, or biking on your trainer? And the answer is absolutely yes. With the treadmill, it's really the same type of running related injuries that you would get with running outdoors. So overuse injuries, the number one area of the body to get injured with running is your knee, and particularly the front of your knee, getting anterior knee pain, or I think Tiffany had up there patellofemoral pain syndrome. It's kind of the same thing. So your running form really comes into play with that, as well as slowly ramping up your activity. And then as far as on the cycling side, with spending time on the trainer, it actually, in my mind, is more important to have a good fit with your bike on the train, like if you're doing a lot of stuff on the trainer or on a spin bike too, because you tend to be in one position for a lot longer when you're on the trainer than when you're biking outside. Yeah.
So ask you, does eventually happen.
It's inevitable. Yeah. Yeah, great question. So, Nikki had talked about, injuries in the youth athlete, but we really didn't discuss what the difference is with the older adult or master's level runner. And as we age, it's again inevitable. We're going to get more stiffness in particularly our tendons. And so stiffness in our tendons, that means that it isn't getting transferred load as well. So instead of getting injuries around the joint, older adult runners tend to get more tendon-related injuries. So like Achilles tendonitis, hamstring strains are more common in older adults as well. And what tends to happen as we age is our training load, particularly with doing more speed work, really decreases. And because of that stiffness that's occurring, also our running form tends to fall apart a little bit. And we tend to be a little bit more upright and not let our hip open up as much. So things to mitigate that are doing that stretch that Tiffany showed with the 1 foot up on the step, and making sure when you are running that you're maybe leaning slightly forward, not bending forward, but leaning your center of mass forward to open up the hip and allow that to happen. One other mistake older runners will make too is they'll transition away entirely from running on harder surfaces, but actually you want that impact to help the health of your tendons. So making sure that you're getting some of your training on harder surfaces too. Mhm.
And I'm gonna add to that too, being female.
Yeah.
I think, now that I think it's really important to work with your primary care provider or your gynecologist, especially as we enter perimenopause and menopause. Joint pain can be alleviated from the majority of women can safely take hormone replacement therapy, and you just need to talk to your primary care. And the great thing about Bozeman is that there are a lot of primary care practitioners who are entering perimenopause and do the sports. So, and now that, we've sort of blown the myth of HRT is dangerous for everybody, your primary care person can help with that. And then For both sexes, we do need more recovery time than we did when we were younger. You know, it may be, as we get older, that we invest in massage at least once a month. We just don't recover as well, so.
So, ability, deficits with runners and people who are from the area. Are there typical like strength deficits that you see that make runners?
Yeah, absolutely. Do you want
Yeah.
Yeah.
Yeah, the runners, everything, especially road runners, track runners, everything that goes in this motion is really strong. But what we don't think about is from this point of view, we're weak in the outside of the hips, we do this. So weakness in this plane versus your sagittal plane can lead to all kinds of problems. And I've seen like great D1 runners who you put them on their side and lift their leg up and they can't hold it against gravity. You know, and these are people who are way faster than I'll ever be, or ever was. And so, yeah, we do see those strength deficits. I think it's getting much better. I think coaching is getting much better. We're emphasizing weightlifting. We're not afraid of it as much as we were. Sort of our generation coming up, you know, it was all, you gotta be thin, you gotta be thin, you gotta be thin. And now we're realizing you gotta be strong. You know, that's, so lots of core, lots of working muscles that running we don't think about. So, yeah.
And yeah, from a performance standpoint too, I mean, there's a lot more recent research really showing the benefit of weightlifting for endurance sports and really busting that myth of like wanting to not bulk up muscular wise because it's going to decrease your running economy or your efficiency with your sport. The benefit of that increased strength outweighs any of the loss in running economy because of weight. So doing things like squats and deadlifts as part of your training is really important.
Yeah, I think Nikki and I have had a pretty unique opportunity to see some like truly fastest runners in the world. Got to live with them and train with them, and I always joke that there's three things they're really good at: recovery, they take naps all the time, they sleep, they eat, they massage, they foam, they Olympic lift, power cleans, deadlifts. They lift heavy and they lift hard, high intensity, because that's exactly the opposite of what they don't get. And they're really good for so that stressful is part of it, right? The load management, all those, the capacity building, the recovery, and the stress management. So I think that's something when I was coming through college running too, is like, maybe we should be lifting hard and then, you know, spending time with a lot of, you know, the people winning the races that there's 2 or 3 hard gym sessions where they're not doing body weight stuff. It's heavy for them and hard, high intensity.
What's your thought now on like weightlifting for kids, like middle school kids that are still growing?
So it's beneficial for them, and the paramount is that they're doing it with initially really good supervision for form, you know, so that they can maintain good form, and then two, that they're doing it at an interval where they are getting recovery from it. Because as Nikki had indicated, it's not necessarily the muscle or the tendon that's a weak link, it's the growth plate that's the weak link. So making sure that we're not pushing things too hard to where they're getting irritation at the growth plates of typically where tendons are attaching. Mm-hmm.
So say, you know, your kids growing and they start to have the start to have the pain, you worry about that. What do you do in the next month? Like, keep them moving, to change activities, what do you do?
Yes, keep them moving.
Definitely keep-
Yes, change activities, but decrease load, make sure the caloric intake is high enough that, you know, it takes a lot of calories to grow up. So you do really want to make sure that's happening and that they're getting a good balance of nutrition. You know, just getting them doing movements that aren't necessarily the sport they do. But you still want them doing the sport they do to the point that they're not, you know, as much as they can do without increasing that injury or being painful. You still want to be doing the sport, but you're kind of focusing on other stuff.
Yeah, I totally agree. I echo what Nikki said. I keep it moving, modify their sport and activity as much as I can, you know, within reason. I think the one thing that in the last couple of years, is more the youth athletes that has emerged and following it. And as I see youth athletes and hear their parents, I ask them what time they go to bed. And the mom and dad are like, oh, you know, 9 kids. I ask the kids. They're like 2 a.m. What are you doing till 2? They're not kids, but most of them on the phone.
Yeah.
And sleeping, hands down, the most underutilized performance drug.
Yeah,
So-
phones should not be in bedrooms. Period. So. But you can be strategic too with keeping them moving, like especially if they're in season. Decreasing the load, their training load during practice so that they can still do competition is a strategy for that too. Yeah, great question. So we're not waiting for it to completely disappear. So we're going to be really giving people boundaries in terms of what level of pain intensity is acceptable. In my mind, as long as it's not changing their form. So to go back to running as an example, if you're able to run and you're having some soreness, but it's not causing you to limp, then that's okay. And especially as it's not progressing throughout your run. And that when you're done with your run, it's going away within 24 hours is kind of one of the main pieces of advice we'll give people. But then we're really trying to build capacity and doing a lot of things outside of running in that example to get you at a better place. And so when that pain finally does go away, it's not making the mistake that AJ had on that graph where pain's away, but the capacity is not there. And sooner than later, that pain's going to return as you get back into your sport. But yeah, we're really trying to keep people have some level of training for the majority of overuse injuries. The one exception being bone stress injuries, where it's a stress fracture that you have to shut down running for sure for a period of time.
You've talked about weight training in terms of like being good to go with running. Are there any other sports that you find runners embrace to help supplement for training they don't necessarily receive while running? Makes sense.
Yeah, my favorite cross training is skate skiing, like Nordic skiing, because as Nikki was saying, like getting that lateral movement for hip strength is really important. And you know, we live in a place where it's maybe not as pleasant to run year round, and it can be a nice break from a high training volume over the winter of running, and where maybe you can still keep a high training volume, but supplementing a lot of that volume with Nordic skiing. Do you have anything else to?
Yeah, well, and this is anecdotal, but I mean, I've been in ultra running since the 90s. Those of us who last crazily, these, you know, who have careers over 20 years. And the thing is, we do a different sport. Like the folks who live in places where they can run year round, they just don't last as long. So, you know, I mean, that's key.
We are kind of lucky here. Forced change in your activities.
And it has to be forced because there's a little addiction.
I'm always, I feel a lot of runners and skiers to go, or excuse me, runners and skiers to go climbing. Pretty low stress on your lower extremities, and they can just feel like they've got ripped on it. It's usually they're searching to feel tired. And if they want to feel tired, they'll take 2 top ropes at the gym and you know, and I like that. Versus I'm gonna throw in an extra half an hour run to go to the gym with my legs out, and now it's subsequent workout on the next day's toes. So caveat is I'm probably not holding. So,
Yeah.
Yeah.
I was about to add something.
First of all, you guys, awesome presentation. It's really cool.
Thanks.
I work with a lot of athletes that are transitioning between skiing, running, different modalities. And, it's interesting that it holds true when you're coming back from injury or trying to prevent injury too. I feel like it's really common for people to sign up for the run or whatever, be like, okay, sign up for this event, I'm gonna go do better start doing some running intervals to get ready. Yeah, yes. But if you actually wanna make a strong physiological adaptation and get fitter, you gotta first focus on frequency, so how often you're doing something, and then it comes duration, meaning how long you're doing that activity, and then finally comes the intensity. And so for cross-country skiers who are transitioning into running, I'm always like, okay, you gotta get out the door, you need to be bare minimum out the door 3 days a week for 30-minute runs, then it's 4 days a week, 60-minute runs. Then you build those 60-minute runs into a 2-hour run, and then finally we can talk about doing intensity. You gotta first build the frequency, build duration, build the intensity, and the same goes, I think, if you do get injured, say you're injured cycling and you're gonna pick up running or vice versa, it's really easy for people that are fit to all of a sudden be like, okay, I'm a fit runner, I'm gonna go do intervals on the bike. No, you gotta first build your frequency, get out the door several days a week, build your duration up to 90 minutes, 2 hours, whatever, and then you can think about doing intervals. But I think when we're switching modalities, especially as fit individuals, it's easy to get injured because you think you're fit, you're gonna go transfer this fitness to another modality, another activity, but unless you do the first, frequency, duration, intensity, it's problematic.
Yeah, the hardest part is usually not.
Yeah, intensity is the icing on the cake. It
Yeah.
really, for most people, would generally benefit fitness wise from just focusing on the frequency and the duration of their workouts, and then finally tacking on the intensity as kind of the icing on the cake. Sure.
Yeah, that's an excellent point. Because I mean, your body needs to have the stimulus to adapt to it. And what Andy just outlined is how your body is going to adapt the best to the rigors that you're putting it through. Any other questions? Yeah. Any sports that kids shouldn't play?
No.
No, not that I can
No.
bring. Yeah, as long as it's fun. Yeah. Those are great. Yeah, those are good questions.
Here's another one. If you're trying to do like multiple sports, like running and biking at the same time, do you have any recommendations for that? Just
Well, these two are more are in more of the coaching realm than I am, or Andy. Yeah.
It's pretty dependent. Feel free to chime in if we get one best coaches around here. But I see a lot of athletes that are, I coach climbers, but I'm a runner, biker, skier, climber too. It's a tough juggling act for sure. It definitely takes a lot of time to do it wrong before you finally get it right. It's for me, it's very, the coaching side of it, it's very much who are you, what's your history? Again, like, if Andy gets injured, we're gonna ramp up his skiing a lot faster than we're gonna ramp up my skiing because he's had 20 years of skiing history. So for a guy like him to keep cross-country skiing and at a moderate level and pick something else up, it's a lot easier. You were a basketball player in high school and you want to sign up for a marathon to climb and then also mountain bike out here. Those might not equate to a whole lot. You were a good athlete and had a lot of athletic sports stuff, but they might not equate to the capacity or the loading tolerance of those activities. And that becomes a very tricky battle, especially when you're psyched.
But
That's tough.
yeah, and I coach some runners who also bike. And I have one actually right now who I had to be very pedantic with because I programmed an easy week running, and I'm not looking necessarily at his cycling, but I luckily puts it on Strava, so I see it. And so he wants to, because he has an easy week, start doing like time trials and long rides. And I'm like, no, this is your easy week. So that's one of those things that we're like, oh, well, it was an easy week for running. Like, that didn't give you your rest.
Yeah, I think one thing is load is low, your body doesn't care. Whether it's stress at work or bad night's sleep or 10-mile run or hard 20-mile bike ride, like it all costs something. Depends how big your bank
It's right. Yeah,
So for like the school age kids that are really running, it's running, I know you gave like hours per week that they should be running. Is there like a max distance that they should be running at that age? Like if they wanted to run a 40K, they do. I mean, I don't.
I mean, anecdotally, you read about young kids doing marathons and, even ultra marathons, every year. I think the key is how are they progressing towards that, as well as, is it truly their motivation, or is it someone else's motivation is probably the first question to ask. I don't know, do you have anything in terms of like
we don't have long-term studies on kids who, insist on running marathons when they're 7. I mean, it feels wrong to me, but I don't have any evidence to point to. And it is one of those controversial things, like you have an ultra run, like, do you have 18 years as your lowest age? I mean, like sometimes it's good that we're living in a litigious society because, your race insurance is like, yeah, no,
They're not gonna-
this 50-miler if they're under 18. That's just one of those, not much.
I think the biggest thing is really, hopefully they're being open with you as their parent and letting you know if like they're getting sore, or if you see them, start like they're limping, they gotta be, you gotta cut that down. But if they're able to slowly progress, then it's, whatever their body's allowing them to do in terms of the actual mileage. Mhm. Cool. Any other last questions? Awesome. Well, thank you so much for your attendance tonight and all the great questions. One last plug to help support our local trails with either a donation to GVLT or SWIMBA. We're suggesting a $10 donation for this, but again, thank you for coming out. Any questions that come up, we did have our email addresses up here, or now you know where the clinic is, so you can give us a call or give the front desk a call, or our cards. Yeah, we do have business cards. Yeah, so you can grab one of those too, and we're always happy to answer questions. And again, hopefully we don't actually see you in here with an injury, or if you do have an injury, get in here sooner than later, because the sooner you get in, usually the easier it is to rehab and get back to doing it. Whereas if you're kicking something around for a month or longer, it's probably not going to get better on itself, unfortunately. So. Cool. All right. Thanks, everyone. Have a good evening. Mhm.